Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalza.
On today's episode, we're going to answer the age-old question, how long is my total knee replacement going to last?
We don't know. Thanks for watching.
Good video. Seriously, the answer kind of is we don't know.
We don't know.
What's the more detailed?
Well, I mean, 10 years ago, I used to tell my patients that these implants are going to last 10 years.
Okay.
10 years goes by, and all of a sudden, these implants are still lasting. So I've changed my speech to 15 to 20 years. The problem is some of these implants haven't been around for 20 years.
Yes.
So we don't have studies that show when they will fail.
Okay, so let's go back. So why do knee replacements wear out, Paul? How do they wear out? Does the metal disintegrate?
No, usually it's the plastic part that starts to wear.
Right.
Little plastic particles cause what we call osteolysis, which eats away at the bone and loosens the implants.
Right.
That's kind of the natural long-term failure process for a total knee replacement.
Yeah, and that's also why some companies have tried to make artificial joints of metal on metal, trying to get rid of the plastic altogether, but that has a whole host of its own kind of issues.
Doesn't work. Right.
So what are some factors that predict or help predict how long a knee replacement is going to last?
Okay, so one thing that we know is if you're going to try and become a professional athlete, it's probably not going to last as long, right? A lot of activity on them, more than sort of normal sedentary type sports, that can wear it out quicker, for sure.
Yeah, I certainly tell my patients, once you get an artificial knee, you are no longer allowed to run for exercise.
And this can be frustrating, right? Because you got an implant because you want to be super active. Now someone's telling you if you're too active. It's frustrating. Like the other day when I was trying to take the price tag off my no-stick cooking pan, and I couldn't.
Ironic.
It's a no-stick pan. Why can't I get the price tag off? Same idea.
Same idea. So yeah, so people are frustrated, and I say, listen, if you're a runner, get it all out of your system before you get an artificial knee, because it's just not designed for that. Physically, could you run? Yes. Could you maybe even run quickly? Yes, but it's going to artificially wear out your joint.
Right. What else? Any other factors?
For me, the age that it goes in. So when I see my patients and I'm looking at a 55-year-old that's getting a total knee versus an 85-year-old that's getting a total knee, the 55-year-old has very different goals and is going to be doing typically a lot more stuff. So they have a higher chance of wearing it out quicker.
Plus, and to look at it objectively, the 55-year-old, hopefully needs that knee to last 30 years.
Yes.
The 85-year-old needs that knee to last,
10, 15
years. Okay,
yes.
We don't want to get too morbid.
Yep.
But you do the math, and it has to last longer in a young person.
Absolutely. Anything else?
BMI.
Yep, for sure.
A high body mass index puts an extra load on the joint, so it makes sense that that's going to wear it out quicker.
Yeah, bigger patients for lots of reasons are going to put more stress, particularly on that plastic, and it's going to wear out faster. Not measurably, we can't say, well, because you're this size, you're going to take 2 years off. It doesn't really work like that. But in general, staying active with low impact activity, keeping at a healthy body mass index is the way to give yourself the best chance of having your implant survive.
Right. Now, something can make these things fail real early.
Okay, like?
Fracture. If you
Yep.
break the bone around it, that's going to happen.
Infection?
Ooh, that'll do it too. Infection, or a dislocation.
Yes. And I would say malalignment as well. So we use navigation for our knee replacements because we believe strongly that if we make your leg perfectly straight, it increases the chances of more symmetric wear. So if you have a really crooked knee after you have your knee replaced, that has a higher chance of having eccentric wear, or one compartment wears out faster.
Right. So, bottom line is these things are going to last a long time.
Yes.
If everything goes well and everything goes right. Nothing lasts forever.
No.
Diamonds, they last forever. Aside from that, nothing lasts forever.
And I think that's also the take-home message for us in the office. That's why we tell people, wait as long as you can, so that if you get it when you're young and it wears out and you have to have it redone, you know that you had no other choice. And it's just the way that it is, the hand that you're dealt.
Right. Hopefully they last longer than until I retire.
Yes, but we do a lot of revisions anyway, Paul, even if they're not ours. True. Okay, so hey, if you like this video, please like it and subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.